Hi, Fred. Nice to see you today, Bob. So, you're talking about how to brace your core to avoid injury, walk better, and in Bob's case, who likes to practice boxing, hurt a little bit less when he gets punched in the stomach. Bracing the core is a term many people use to talk about how to support your chest and spine on top of your pelvis. We have only a single bony column of our spine connecting our hips to our chest, and a lot of muscles around there which have a lot of wiggle room, which is good, but it also means that there's only one solid support in our back to keep us upright. And if we don't know how to use our abdominal muscles, then our back will do too much work and we end up with a lot of back pain. Also, if we know how to maintain an appropriately braced or gentle, stiff core, then every time we move, our hips can push against our abdominal muscles to move our chest. If we have a soft belly, every time I try to move, my back is going to do weird things. So today I'd like to talk about how to brace your core to help prevent and heal back pain, as well as move better and breathe better. You can think of your abdominal area as a bit like a pressure container that your chest floats on in the bowl of your pelvis. So if you were to look at the anatomy on the inside, you could see that there's a little bit of a bowl here on the pelvis. And unfortunately, Fred has lost his diaphragm. But the diaphragm is a muscle that helps breathe and pull air into the lungs and push it back out. And as you can see, it looks like a dome. So we have a dome and a bowl that is a pressure container in our belly. And if we use our abdominal muscles appropriately, then our chest will float on top of our hips and it won't just rest passively on our spine, leading to spinal arthritis or bad spinal movement. So there's a couple of really simple tricks and mental images that we can use to protect our back by bracing our core. So one is we want to make sure that our pelvis is not tilted too far forward or too far back. And so if you place a hand here at just below your belly button and another hand here right at the bottom of your rib cage, we want to try to flatten those out by tensing your abdominal muscles here. So we don't want to open them up and we don't want to be collapsed here. We want to keep this area nice and flat. Another way that we can tell or help know if we're doing it right is if we put our fingers between our rib cage and our hip bones. For example, Fred has a nice display right here. And then we try to fill our belly with air and use those side muscles to push our fingers away. We don't want to hold it too tight so we can't talk, but we just find that muscular tension and then hold it just enough so that we can still talk nice and evenly and take breaths. So once you're able to push these fingers away, it'll almost feel like you're pulling your rib cage down onto your pelvis. Another cue that might be helpful for some other people is I imagine sometimes that I'm walking in cold water that's right at my belly button. And if you do that, you instinctively suck everything in. So can we suck everything without opening our rib cage? We just feel that cold water at our belly button, keeping our rib cage flat, and then suck it in. That will usually result in a gently tense abdomen all the way through the sides. So as you're standing or walking, and especially if you're bending over and squatting, can we make sure to maintain a braced core? Because without a braced core, if I bend over, oops, that's a herniated disc. So play with that. Let me know what you think.